Welcome to Reducing Healthcare Costs, Tools, Strategies, and Patient Assistance. This is a part of a series of health access, advocacy, and policy webinars put on by the Hemophilia Council of California. Today, our presenters, Mandy Herbert from Patient Services Incorporated and Kim Isenberg from the Hemophilia Federation of America, will be going over different tools and strategies that you can use to reduce your healthcare costs and considerations and programs that may change in 2020 and beyond so that you can figure out the best strategy for paying for your care. I'd like to give a big thank you to our 2019 webinar series sponsors, Takeda and Sanofi Genzyme.
And with that, I believe it's time for questions.
I had a question for you, actually. Kim, you mentioned possibly pursuing state-level legislation regarding copay accumulator adjustment programs. And I had a question about large self-insured employers. Would state-level legislation affect those employers if they are, if their PBMs are using the accumulator adjustment programs, or would it not affect them?
It would not, because, thank you for the question, Robin. So accumulator adjuster legislation that goes through a state would only apply to insurance plans that are regulated at the state level, and those are typically smaller employers or the marketplace plans. So if you were in a marketplace plan in California, a bill that would pass would apply to you and would protect you from accumulator adjusters. But if you work particularly for a large employer, say like Target, they bear the risk of your insurance plan. So because of that, all of the laws that have to do with health insurance are actually regulated under ERISA, which is a Department of Labor law or series of laws that went into effect because of when benefits were negotiated through labor unions. So those would not, and that's why we were really pleased with the notice of benefit payment parameters rule that said accumulator adjusters would not apply towards generics. So we have to continue to educate policymakers at the federal and state level about why this is a problem. It's why we've brought insurance commissioners from your state into the dialogue, because they can also be a champion for us with the federal, with our federal regulators and our federal lawmakers. So, so thank you for the question. Yeah, and while there is good news that you can help some people at the state level, you can't help all of the people.
And there was a couple questions came in. One is, what sources other than human resources can assist with these issues? Like if you are worried that you might disclose more information than you want to, talking to your own company's HR, are there other resources that a patient could use to help navigate options and get information on their choices?
Yeah, absolutely. So, so first of all, both NHF, HFA, and your local chapters can be a resource, and I encourage you strongly to reach out to them. There are a number of other, if you Google or whatever your favorite search engine is, patient assistance programs, or how do I pick the best insurance plan for me, particularly if you go to healthcare.gov, there are a number of helpful resources there. They're designed for marketplace plans, but they also, the similar advice could help you figure out if you have perhaps an HMO choice and a PPO choice from your employer, help you figure out sort of how best to do that. I encourage you once again to go back to the toolkit that's available to you through NHF and HFA's website. That's a great resource. And while I don't, off the top of my head, I imagine because California is a progressive state, I imagine that your state has some resources available through some sorts of ombudsman in the Department of Insurance.
Thank you, Kim. And a question for you, Mandy, which is, how many people are helped through PSI's premium assistance program, and Is that fairly stable? Has it been going up or going down?
Sure. So we are estimating that by the end of the year, we're probably going to assist between 380, 385 patients. And that's been pretty stable over the past couple of years. So I'm happy to say that with each new year, we have been able to take new applications within the program throughout the year. So fortunately, the funding has supported the program very well, and we have not had to, turn away many new applications. So that's great news, and we're hoping that will continue in 2020.
Fantastic. And then are there any more questions? Anyone who called in who wants to ask a question? You can, you're unmuted on our end.
This is Kim Ross in Oakland, California, and I wanted to ask if a person could use both the PSI and the manufacturer assistance program.
Sure. So this is Mandy at PSI. So our program solely supports patients with their health insurance premium. So if you wanted to apply for the manufacturer copay card program, you certainly could.
Okay. I've always thought it was one or the other. Thank you.
If it was the same assistance type, so say we had a copayment assistance program, that would be a different case. So usually if we have a copay assistance program that you're getting support through, we wouldn't usually support, let me reverse that. If you're on a manufactured copay card program and getting financial support, we on our end usually wouldn't provide additional support under copay.
Sure. Okay. Great. Thank you.
And then one other thing I was going to throw in is Mandy went through the measurement of 350% of the federal poverty level as the guideline for getting premium assistance through PSI. It is my understanding, and if someone knows better, please correct me, because I haven't looked into it this year yet, but the manufacturer's copay assistance programs, they're available to anyone, so they don't do a means test.
Right. I know for those you have to have commercial insurance for the manufacturer copay card assistance programs, but yes, there is no kind of financial income criteria that a patient would have to meet.
Thank you.
You're welcome. I know there's probably a cap on assistance. It might be $12,000 a year, but in regards to an FPL, that's not something that they would request.
Okay.